We're gonna make sure we get going right now. So looks like we got a good number of attendees here. I really appreciate everyone's interest in being a part of tonight's presentation called The Truth About Lower Back Pain and Sciatica. My name is Troy Vander Molen. I'm a doctor of physical therapy. I've been practicing physical therapy now for getting close to 24 years. So with back pain being the most common thing that we see at our clinic, this is something we've learned a ton about over the years, and I'm excited to share that with you. I'm actually going to go to share my screen here so you can kind of see what we're talking about here. There we go. So there's my title page, and we're going to get going. First, I want to just point out to those of you that are newer on the call here tonight, I definitely want to get some feedback from you throughout the day, throughout the presentation. So there is a chat icon on the bottom of your screen. So if you ever want to mention something, just type your message in. That will go here to me, and it will go to all people if you wanted to as well. You can select who that goes to. Also, if you have questions that come up during the workshop that you'd rather have the opportunity to ask a more personal nature, I'm going to give you my contact information at the end of the workshop today as well. So you'll have that, and you can interact. As I said a little bit ago, my name is Troy. I'm a doctor of physical therapy, University of Iowa graduate from about 24 years ago. Got my doctorate in physical therapy from a group in Kentucky called Evidence in Motion. And I've been in an outpatient physical therapy environment my entire 24-year career, and seen a lot of people with a lot of different conditions, but not one condition more so than lower back pain. And our clinic as well, Kinetic Physical Therapy, has been around since 1998. I did a little math this afternoon. In the last 3 years, we've had something like 85,000 client visits. 25% of them or so have been lower back pain issues. So I think that means over 20,000 sessions of lower back pain that our company has helped people with over the last 3 years. So it's certainly something that is common. In fact, lower back pain is the most common condition that people experience. Statistics would say that at least 80% of us will experience at some point in our life. And at any point in time, I think about 24% of the population is experiencing that. At Kinetic Edge Physical Therapy, we have 18 physical therapists and then a lot of other occupational therapists, assistants, athletic trainers, and exercise specialists that do a lot of good work. In addition to physical therapy, the occupational therapists do some really specialized pediatric OT services, working with people with sensory motor deficits. So we're a pretty varied group, but musculoskeletal issues are by and large the most significant thing that we see. And we go to extra measure to make sure that the clinicians that work with us are very well versed in understanding how the body works and moves. 3D maps is a system of training that we require of all of our therapists to understand functional movement in 3 dimensions. And that enables us to understand how dysfunction in movement leads to problems, which is something you're going to hear about today. We'll also do clinical education, internship opportunities for a lot of physical therapy schools, PTA, assistance schools as well. That's really neat because it gives us an opportunity to pass on what we learn to soon-to-be physical therapists and physical therapist assistants. Honestly, though, it's just really good for us because we learn a lot about how to stay on top of our game, and we got to be ready to answer questions. So we get a lot of questions asked to us of these fledgling physical therapists and assistants that make us better as time goes by. And we're honored that so many educational programs trust us to help them care for their students to learn this stuff too. So let's get into it. A workshop is especially for you if you're saying, I've got pain in my lower back and it doesn't seem to be going away. In fact, it seems to be getting worse over time. If you've been asking yourself the question, do I need to have surgery? Then I'm glad you're here. This is a good spot for you to be. If you're concerned about changing in lifestyle habits or movement habits and what that's going to do to the general health that you experience, that's a good question, and that's a good reason for you to be here today as well. It's frustrating when we feel like we get more dependent upon others or just have to self-select what kind of activities that we do because of a concern about pain. If you're afraid of moving the wrong way and getting that sudden jolt of pain, believe me, you're not alone, but this is a good place for you as well. If you don't know what to do, if you've tried a lot of stuff and just haven't found the solution yet, then this is a good spot for you to learn today too. I'll also say though that if you're looking for a quick fix, if you are just interested in masking your symptoms, this probably is not the place for you. If you're not interested in having the knowledge and independence to help take care of your issue once and for all, and to understand how to naturally heal your body, then I wouldn't be offended if you just wanted to opt out right now, because we're going to hear a lot about what you can do for yourself to naturally heal the issues that you've been dealing with without depending upon injections, medications, and surgeries. So let's start out right here. I want to ask some questions. We're going to use this chat feature. This is a set of questions that we ask people that come into our clinic regularly. It's going to help me understand if we can give you some answers tonight that will be beneficial for you. So I want you to tell me what activity that you do over the last 2 weeks anyway, that's most likely to contribute to your low back pain or worsen your low back pain. So go ahead and write that down if you can. This is my first time ever doing one of these things. Okay, good. It's starting to pop up here. I'm going to click on the chat feature. Try that again. There we go. So we've got people that are hurt with their low back when they rake leaves. There's plenty of leaves to be raked after the winter season, that's for sure. Operating a machine at work. So I don't know if that's a sitting activity or a standing activity. It's probably an activity that requires you to get out of a neutral position. We have someone that says bending over for any length of time. Bending is one of those issues that can be problematic for many people. Another person said yard work, any form of exercise, housework, inactivity, sleeping down, laying down to watch TV. That's interesting. We'll talk a little bit about that today as well. Someone that said that kettlebell workouts can be really difficult for them. That's an interesting one because, well, we'll get to that. There's certain movements that are going to be problematic if the body lacks an ability to move in another place as well as it ought to. So we'll talk a little bit about that. Back pain nightly, someone says, after a couple hours of sleep they wake up. And someone else is saying pretty much having pain since December of 2018. So that's certainly a problem. The next question we'd ask is, what's your pain rating between a 1 and 10? 10 being emergency room pain. Get me to the emergency room right now. And 1 being just really mild. Tell me, if you would, again, using that chat feature, the highest pain and the lowest pain. And then how long have you experienced it as well? All right, we got some stuff coming in. We've got someone that varies between 3 and 10. Got someone that's in the 5 to 6 range, between 7 and 2. Certainly pain is a subjective experience. Your 5 might be someone else's 8. So it's not very predictable from person to person, but it's really interesting to see that people have pain that goes up at times and goes down at times. And that's actually, in a weird way, a really good thing, which we'll talk about in just a little bit as well. So off and on, 4 to 7, 2 at the lowest, 8 at the highest, all good answers. That's good. I'm encouraged by the fact that people will tell me that it goes up and it goes down, because that's a good sign that what you're going to learn here today could be beneficial for you. All right. You know you're in the right place if your pain is reproducible. And most of you had said that. Certain activities, certain positions cause the pain to get worse. And that is kind of a good thing, because if the pain gets worse with a certain motion, then it's likely to get somewhat better with a different or maybe even an opposite motion. So there's lots of things that can contribute to that pain, and evidence, the pain that comes on with a particular activity is evidence that it's a mechanical problem. If it's reproducible, it's also reducible. So those are good signs. So I want to give you some encouragement that we think that if you follow our structured process here, your future is bright. Everyone knows that when they hurt, it's hard to be in a good mood. When we're in a worse mood, it affects those that are closest to us. It affects those with which we have the closest relationships. That's actually a theme from tonight as well. When we seek to solve a mechanical musculoskeletal issue, you don't just look at what's in pain, you look at what's around the stuff that's in pain. And the good news is if you can reduce pain in that area, you're going to move better, and overall your general health is going to get better as well. General health problems often follow mechanical musculoskeletal issues because we don't move as much. And that leads to increasing rates of the more significant problems of heart disease, diabetes, obesity, and depression as well. And it also means that if you can improve your lower back pain by improving those other risk factors, it's less likely you're going to go to see the doctor. You probably need less medication, fewer surgeries. Unfortunately, if you stay in the same path that you're on, things tend to go in the opposite direction. And that increases your risk for more significant things. I want to point out that there are two kinds of injuries. And so I got a graph for you. On the vertical axis, you can see tissue damage. On the horizontal axis, you see time. And there are acute types of injuries and there are cumulative types of injuries. Maybe some of you had lower back pain that began very suddenly with one incident. Here's what this looks like. Sudden tissue damage, and then over time, the body resolves the issue, and we get better, and we get below that symptom threshold. If you slip, trip, or fall, if you were involved in a motor vehicle accident, if there is sudden trauma that leads to an immediate symptom, it could be that that problem was an acute issue. But I will tell you that most of what we see in the clinic is not acute in nature, it's cumulative. And what you're seeing now, that slow progression of tissue damage over time, is something that took a few seconds on my graph here, but actually could have occurred over the course of months or years. And the other thing is not everyone's symptom threshold is the same. And so the amount of tissue damage it takes for you to experience some symptoms might be different than someone else as well. The bottom line is we need to understand what causes that progressive cumulative tissue damage, stuff that we'll probably see evidence is occurring to some degree if we did some kind of diagnostic testing to your lower back, and find ways to take the stress off of that tissue so the body naturally feels better. And that's what tonight's all about. And when people start to experience pain, maybe this will be a story that you can relate to. Generally speaking, the first thing that people do when they have some kind of a problem, and in this case, we're talking about a physical problem, is they tend to ignore it. I think men are particularly guilty of this. If they experience a pain, they just want it to go away and they just try to ignore it. And sometimes it actually does go away, at least for a little while. But if we don't do anything to change the issue that brought it on in the first place, it's likely to come back again. And I alluded to that earlier. We see that with the clients that we serve in our clinic all the time. People telling us a story, well, it used to be a small problem, now it's a medium-sized problem, or it's a pretty big problem. And when you get to the point where you realize, you know what, I can't ignore this thing anymore, I gotta do something about it, most people automatically default to solutions that simply alter the problem. So some of you are probably taking over-the-counter medications, or maybe sought some kind of a self-treatment online, or bought something that you saw advertised on the television to deal with your back pain. That's usually not getting to the root of the problem, but it might alter it to some degree for a temporary time period. And in all honesty, most of the stuff that you get when we seek medical treatment for lower back pain is all about altering the problem as well. Medications don't get to the root of the problem, they just deal with the pain in many cases. Injections are a way to get medication directly onto a tissue instead of taking it systemically through something that you orally ingest. Even surgeries. The surgery doesn't fix the issue that brought the damage to the tissue. It just tries to get rid of that damaged tissue. It's altering the problem. What I'm going to challenge you with tonight is hopefully to find a way to actually solve the problem once and for all, to get beyond just the area of pain and to find the solution to the cause of the pain. So a key point I want to make before I move forward to talking about the types of back pain and the causes of back pain. Number one, almost all these lower back issues, in fact, almost all musculoskeletal issues are mechanical in nature. In fact, there's some studies that have indicated that about 90% of back pain is mechanical in nature. Only 10% are medical in nature. And that's why most of the things that we do to help our back pain are nothing but temporary fixes that alter the problem but don't get to the root issue with this thing. You cannot treat a biomechanical problem with a biochemistry solution. It just does not work, at least not long term. We can get encouraged by some immediate pain relief with some of those treatments, but all too often we're left disgusted when it comes back again because we thought we had a solution and we didn't. And that for many people is a stealer of hope and joy and happiness. One of the things that happens when we have an injury is we go through this natural healing process. And I don't want to get too much in the weeds on this thing, but you'll see phase 2 of wound healing. And wound healing, we think about a cut on our skin. It's true, but wounds that happen internal to the body and not external, things that we don't even see evidence of on the surface, go through this process as well. And phase 2 is the inflammatory process. The inflammatory process is what provides this new framework for blood vessel growth. And then that's followed up by this proliferation stage and eventually a maturation stage where that tissue gets stronger and stronger and healthier. What do we do so often when we start to experience pain? Well, we'll get an anti-inflammatory. There's no doubt that inflammation can lead to discomfort and pain. There's pressure on tissues that exist when inflammation occurs. Those tissues get sensitive and the nerves will give a sensation of pain that the brain translates. But what is inflammation really? Well, it's a necessary phase of healing. If we immediately deal with an inflammatory condition with an anti-inflammatory, we're reducing the likelihood that we'll get this solid framework of blood vessel growth that's necessary to deliver nutrients to that tissue and be healthy over the long haul. So I'm going to tell you, I'm not a total disbeliever in the use of anti-inflammatories. I think sometimes in short-term cases it can be used, but it shouldn't be something you depend upon. You need to allow that healing process to move forward, and ultimately you need to look beyond the area of pain and find out what's causing that to occur in the first place. I want to tell you a little bit of story about a guy that I know. Randy on the call here knows him well too. This is Andrew. Andrew actually is a physical therapist. Andrew is also a gentleman who had extreme problems with back pain when he was about 24 years old. This is at the time that he was getting done with his undergraduate work and preparing to go to physical therapy. And he tells the story that for about a year he was dealing with pain that was bordering on 10 out of 10. And he was hurting, he was desperate, he was looking for all kinds of solutions, and he did everything that that you hear many people have gone through. Medications, injections, and surgery. In fact, his surgery that he had a discectomy procedure done, immediate pain relief that unfortunately only lasted about a week, and then the pain came back just like it was before. At one point in time, he was taking some narcotic medications, the pain was so bad. And his wife, who was laying next to him in bed, was counting his breathing and noticing that his breathing was slowing up to the point where he was taking a breath about once every minute. And that's what narcotics do. That's what opioids will do. It suppresses your respiratory system. And he was dangerously close to something that happens all too often. Last year alone, in 2019, there were 70,000 accidental overdoses that led to death in the use of opioids. So we want to stay away from that stuff for sure if we can. Ultimately, Andrew was experiencing a lot of anxiety and depression and loss. He didn't know what to do. Thankfully, he experienced a turning point. This turning point occurred when he went to physical therapy school and finally assessed how his body moved. And he learned that his hips that are a ball and socket joint, made to do a lot of motion, in particular rotation motions, his hips were not doing that motion well. Internal rotation, I believe, was locked at near neutral, and hips are supposed to internally rotate much more than that. And unfortunately, if you think about what happens, every time we take a step, right foot past left foot, past right foot, past left foot, we're planting and rotating over the hip and pelvis. And if the hip doesn't move the way it's ought to into rotation, something has to cover for that lack of motion. There's another area that has to pick up the slack, and usually it's the closest neighbor that has to pick up the slack for what a particular part couldn't or wasn't capable of doing. And so that's kind of the moral of our story tonight. There are things that hurt, and there are things that cause that stuff to hurt. And we need to get to the root problem, the true cause, in order to get rid of the pain in the first place. So why do we teach this stuff? Believe it or not, musculoskeletal issues are the number 2 reason that people go see their doctor. And doctors have an amazing breadth of information, but unfortunately, doctors don't have a whole lot of training in musculoskeletal issues. There was a research study done several years ago that I think 85% of doctors do get some musculoskeletal training, but it's classroom training in the first 2 years of their training. Only 15% get training that is practical, meaning they're actually working with people as an intern that have musculoskeletal issues. So they're just poorly trained to manage musculoskeletal disorders and back pain in particular. And as I said before, that leads to things like the prescription of medications, injections, and eventually going to specialists that lead to surgeries all too often. And the use of opioids is a scary thing. A year ago today, this whole opioid crisis was at the forefront of our attention. Something else nowadays is taking some priority over that right now. And I've been watching intently because thankfully, one of the good things that's come out of the COVID-19 epidemic is that we have the better ability to connect with people in their homes through telehealth. But before, PTs even had access to telehealth to the degree that they have, at least temporarily now with the COVID-19 epidemic. Doctors were able to see people online and prescribe narcotics. And I have a concern that an inability to get in to see the people that you need to deal with the root cause of your lower back pain is going to lead to more people getting narcotic medications and more deaths occurring as a result of that as well. Surgeries have increased by 150%. That's more than doubled over the last 10 years as well. And we're going to learn that surgeries all too often are not the solution. The statistics of outcomes are not very good with surgical procedures for the lower back. Ultimately, movement-based problems, mechanical problems need to be managed with mechanical solutions, movement-based solutions as well. So you need a movement expert for that. So we got the blackboard out now, and here are the 3 lessons I want you to know. The 3 most common types of lower back pain. I think today most of you are going to say, okay, this is me. This is what I think I have. You're going to learn about the 3 most common causes of lower back pain. It's important to note the type of low back pain and the cause are 2 entirely different things. Types will describe what hurts, causes describe why it hurts. And then we're going to talk about successful treatment of lower back pain based upon those causes. So the big idea is this. This is C.S. Lewis. C.S. Lewis wrote in a book I think called Miracles many, many decades ago. The magic is not in the medicine, but in the patient's body. What the treatment does is to stimulate nature's functions or to remove hindrances. And that's what I want to do tonight. Help you learn how you can help yourself to stimulate your own body's natural capabilities to function and feel better. I want to first start out by talking about sciatica and make a point that sciatica is a description more than it is a diagnosis. Sciatica occurs when you get pressure on either the nerve roots that contribute to the sciatic nerve or the sciatic nerve itself. So you can see on this picture on your screen that sciatic nerve, which by the way is the largest nerve in the human body, running from your buttock all the way down the back of your leg, leaving branches all the way down the leg until it gets all the way to your foot. It's made up of branches from the 4th lumbar level all the way down to the 3rd sacral level. When that thing gets mechanically compromised in some way, you're likely to have some pain. This is a good picture. It's kind of dramatic in that it shows this red area, but any place in red can be experiencing pain if you have pressure on your sciatic nerve, if you have sciatica issues. And that might be because of pressure on the nerve roots itself. It might be because of direct pressure on the sciatic nerve as it travels through the pathway all the way down the leg. About 50 years ago, there was this really unique study done where they laid people down on a gurney, put local anesthesia into their back, but they stayed awake. The doctor introduced something into their low back that prodded and started to push against different areas of the spine. And they found that if you push on lots of areas of the spine, you're going to get referred pain into your buttock or into your upper leg. But the only way you got pain to go down the leg past the knee was by pushing on the nerve root itself. So there are some of you that probably have pain that goes into your buttock, even into your upper leg. And I would argue you may not even have sciatica if that's the case. That might just be referred pain from something mechanically compromised at the back itself, not the nerve root or the sciatic nerve. But sciatica issues are definitely problems. And they could be a part of any one of these 3 types of lower back pain. These 3 types of lower back pain that you see on the screen right now make up 80 to 85% of all people's lower back pain. So let's start by talking about a herniated disc. I get a lot of people coming and saying, yep, I got a herniated disc. And I ask some questions about that. Herniated discs are not uncommon. They're one of the 3 most common. At L4-5, there are 5 lumbar levels. It's the lowest 2 levels of the lumbar spine. At L4-5 level is the most common disc herniation. You can see the picture of it on there. There's a normal disc on the left, the herniated disc on the right. Usually the disc material will herniate or rupture out in the back side and outside, posterolateral spot, which is unfortunate because that is the area where that nerve root is exiting from the spine as well. But I will tell you this, if you are not 35 years of age or younger, it's more likely than not that, let me say that again, if you are 35 or younger, you might have it, but if you're older than 35, it's more likely you have a different type of pain, not pain due to herniated discs. With people that are younger, they've got a more mobile disc that's more likely to rupture, herniate, and press on that nerve. And that usually will cause numbness and tingling symptoms in the pathway of that particular pinched nerve. Those people will explain that they have pain that occurs when they forward bend, when they cough, when they laugh, when they sneeze, maybe more so when they sit than when they stand as well. And there are, even though I understand the research says that surgeries are not particularly effective in a lot of cases, if you have a pinched nerve that's so significant that you notice one of 2 things, either a difficulty in moving your foot, a foot drop, that's a motor change that's occurring in your ability to move the foot, that's a more significant issue. If you also notice that you have difficulty with control of your bowel and bladder, those are more emergent issues. Those you need to go in and see the doctor, get the diagnostic test, and potentially would need a surgery to remove pressure from that nerve root. But the research would show that if you have a more typical herniated disc, 85% of the time it's going to get better with conservative care within 6 months' time. And the research indicates that unless you have the foot drop or the bowel and bladder situation that needs immediate relief of pressure, your likelihood of getting better with surgery alone is only at 50%. That's a flip of the coin. So I want you to understand that herniated discs, by the way, we're going to talk a little bit about MRIs in a little bit. When you see a picture of a herniated disc like this, it's a scary thing. And that scary thing can lead us to make assumptions that are not necessarily true. We're going to talk a little bit more about that. I will tell you, though, that if you are younger, if you say, yeah, bending, coughing, sneezing, numbness and tingling, I get that. Rest assured that conservative care over time, that thing can heal itself. And we want you to be able to experience that. The second type of lower back pain is SI joint pain. This is sacroiliac joint. So the sacrum is at the bottom of your spine, And it is the part that sits against the wings of your pelvis, the right and the left side. It's called the ilium on each side. And that's a major joint. It's a big joint. All the weight of our upper body, when we're standing and gravity is pushing us down against this immovable force of the earth, is being borne on the sacroiliac joint. People with SI joint issues have problems because that joint, which isn't intended to move a whole lot, it's very secure in most cases, gets a little bit mobile, moves a little bit more than it should, which creates a friction sensation, which leads to inflammation, puts pressure on those nerves, and you experience pain. These people will generally have problems with dynamic movements, moving from one position to another. This pain might radiate. Normally it's on the one side or the other at the dimple at the lowest part of your back where your lower back and pelvis come together. And it might wrap around your lateral thigh, hip area, sometimes even going down into the groin as well. This occurs in people of all different ages. In my experience, a little bit more common in women than men, but certainly lots of men get it as well. During and after pregnancy, it's common because the hormonal changes lead to differences in laxity of joints, and there's more weight bearing on the pelvis during that time as well. Postural changes occur during pregnancy as well that make that a little bit more likely to occur. Some of you will experience this because you fall directly on your buttock, and that leads to an instability due to some trauma. But in most cases, it's a cumulative issue as well. But is it fixable? Sure it is. If you can get rid of the inflammation by securing that joint segment and it's moving less, then you'll have less inflammation and you'll feel better. The third most common type of lower back pain is stenosis. This is also called degenerative disc disease or just generally arthritic back pain. By and large, the most common type of lower back pain. And you don't need to have an expensive diagnostic test to determine whether you have this or not. 97% accurate is this really simple test. If you're 50 or more, if you have pain that's worse when you're upright compared to sitting, and it goes away, at least temporarily, or reduces noticeably when you sit, then it's highly likely that you have stenosis. If you've ever been in the grocery store or Walmart, pre-COVID-19, you see people pushing their carts around, but instead they're leaning on that cart. Their back is flexing like that. That's probably a person that's trying to get pressure off their stenosis or arthritic joint, and that postural change in the upright position helps them to manage their pain just a little bit. Here's another picture. Earlier we saw the picture of the disc from the overhead view. This is a side view now. And you can see there's kind of some, your back isn't really red like this, but you can see some redness to this particular picture, where due to repeated mechanical forces over time, there's changes occurring. Bone spurs are developing something that we call osteophytes. And again, oftentimes those things are going to occur right where that nerve exits. So that yellow piece you see there is the nerve root that makes up at the lower back your sciatic nerve. And what you can see just a little bit, right above that middle yellow nerve, you can see the top of a half circle. And then from the bottom part of the spine, there's another half circle that creates the hole from which that nerve exits. It's called the neural foramen. And when you look at this static picture, there's not any movement occurring, but when the spine moves, the size of that hole changes. So we'll talk a little bit about that. Narrowing of the exit point for that nerve can put pressure on the thing, particularly if there's already some osteophytes in that area that are competing for space in that area. So let's say for a moment that you have stenosis that affects the right side more than the left side. The exit point on the right side of your spine, where that nerve exits, is going to be receiving more pressure, mechanical compromise, when you extend the spine. That's why standing up, when we naturally extend the spine, tends to be a little bit more difficult on people with this condition than people that sit down. The back flexes for a little bit. Because when the back flexes, it opens up. When the back extends, it closes down and kind of winches on that nerve just a little bit. Side bending in the same direction. So if I have a right-sided issue, as I move to the right, that closes that exit point down, and you're going to experience pressure on that side. And if you move in the opposite direction to the left, you open that hole up and you can take some pressure off. that joint or off that nerve. Finally, rotating in the opposite direction. This is harder to conceptualize. And you probably need a more dynamic model to see this, but if I have right-sided pain or from a stenosis-related issue, an arthritic issue, movement to the left with rotation is going to create pressure on the exit point as well. Movement in the same direction actually will open that up and take the pressure off. So we actually, with treatments that we prescribe for people with specific issues like this, will teach them, here are your movements that are going to take pressure off and help you to heal. Here are the movements that you need to do to encourage the natural healing process to take place. These are movements you want to help minimize so that you don't put as much pressure. And if you remove pressure from that arthritic tissue over time, the inflammatory process will die down, the healing process will continue, and over time it can get better. So remember, the success rate of lumbar surgery is 50%. Physical therapy is at 85%. Unfortunately, a lot of people go the surgical route because of this issue right here. This is research that's done several years ago. And what they did, you can see on there under the table description, it says asymptomatic patients. So these are people of various ages that have no back pain whatsoever. They're asymptomatic. They don't have symptoms. So if you look at disc generation, that's another word for stenosis or arthritis. If you're 50 years old, I don't know if you can see my cursor right there, 80% of 50-year-olds that have no back pain have disc degeneration. Well, why is that important? Why would you try to do a surgical procedure to remove the degenerative tissue if 80% of people that have no pain have that same degenerative tissue? The presence of that degenerative tissue does not make you destined to have regular pain. And then there are also all kinds of things too. The disc bulging itself. You can see as time goes by, as the age goes up, the likelihood of people having this goes up as well, but so do wrinkles. And we don't need to have wrinklectomies. I guess maybe some people choose to do that. But wrinkling is part of the normal aging process, and so too are all these changes that we see evidenced in the diagnostic testing that we do. Unfortunately, seeing the picture and saying, oh, that's my problem, leads people to make decisions to seek solutions that ultimately aren't fixing the problem, the root problem in the first place. So don't worry, if you've had an MRI, if you've had an X-ray, you've been told, man, my back, I've been told that's the worst back the doctor's ever seen. That back looks like a 90-year-old's back. I've heard that 100 times more. And I don't want to sound crass, but I don't care. I want to know how you move. If you move better, you're going to take pressure off that tissue and you're going to feel better. The key is moving better, making sure that that area is receiving less pressure because the close neighbors are doing their job. So yes, I will tell you that in many cases, the MRI or the X-ray will lie to you, and it will lead you to make bad decisions. There's a medical doctor in Birmingham, Alabama, James Andrews. He's a specialist in the shoulder, and he's a guy that many major leaguers see when they start having shoulder issues. And he gave a presentation a few years ago to the American Society of Sports Medicine. And he said the quickest way to a surgery is to have an MRI. He was talking to baseball people. But his point was this: the findings that you see on the MRI are normal, and there's a whole lot of people, there's even pitchers that they do annual MRIs on a lot of pitchers and find there's a lot of damage amongst pitchers that have no pain whatsoever as well. So yes, don't worry if you've been told you've had a bad finding on an MRI or an X-ray. I always tell people, if you didn't have a funny finding, you're in the minority. You're weird if you don't have something funny on a diagnostic test. Most people do, even those that don't have symptoms. So here's the most important information I'm going to share with you. We know that the disc degeneration issue, stenosis, is a type of back pain. We know that disc herniation itself can be, and we know that SI joint problems describe the type of pain you experience, but they don't explain the cause of your pain. The cause of your pain, we need to look beyond just the area of dysfunction or the area of pain, and we need to look at how that area around that structure works. First, I want to talk a little bit about movement. Every part of your body will move three-dimensionally. And so for a moment, let's just talk about the 3 dimensions of motion. Rotation is 1 dimension of motion. Rotation occurs in what's called the transverse plane. And then we have frontal plane movement. Frontal plane movement is side bending to the left and to the right. And finally, sagittal plane movement, which is flexion and extension. Those motions are the 3 dimensions that you can make. And if you look at the lumbar spine itself, the low back, the orientation of one spine segment as it hits the other encourages really good sagittal plane movement. There's things called facet joints. There's a bone that comes from the upper spine segment that meets against the lower supine segment. And in the lumbar spine, they're positioned pretty vertically. So they're made to do this kind of motion that will cause flexion and extension. But that is not made to do a whole lot of rotation. Those 2 bony processes will run into each other pretty quickly. So at each segment of the lumbar spine, between 2 of those spinal segments, we only go 5 degrees of rotation in each direction. Side bending can go 40 degrees, 20 in each direction. Sagittal plane motion allows for 40 degrees of flexion and 30 degrees of extension. It's really cool how we're created and made, because those facet joints at the lumbar spine are vertical and allow for a lot of flexion extension, but not a lot of rotation. As you move all the way up the spine to the thoracic spine and eventually the cervical spine, they're positioned in such a way that rotation is much more likely to occur. We're designed to rotate a lot at the cervical spine. We're not designed to rotate much at the lumbar spine. So when we talk about the cause, we need to look at the culprits, and there are your top 3 culprits. Let's talk for a moment about your hips. And I don't want to go into a bunch of detail about this. I think it's important for you to understand how well your hips move. And if you sought conservative treatment in the past, and the person that you work with did not closely assess your hips, I think probably there's something that could be missing in terms of finding the root cause of your lower back pain. What you're seeing right here is a skeleton with 1 major muscle showing. This is a muscle that originates from your lumbar spine. That's area 1 on the picture, and from the inside of your pelvis, the ilia. That's number 3 on your picture. And they run down the front of your pelvis and the front of your hip and connect on the upper part of your lower upper leg bone, your femur. Those are called the iliopsoas, but we just commonly call them hip flexors. These muscles are shortened throughout the day if you're sitting. If you bend the hips and knees, bring your knees up, that muscle is put in a shortened position. If you spend too much time in that position, that muscle can get tight as time goes by. And then when you stand up, that thing lengthens back out again. And this muscle is made, as it's called, the hip flexor, to be a primary worker when you lift your knee up and you flex the hip. But more importantly, it has impact on what kind of movements happen all throughout the body in this area too. If you're tight with your hip flexors, it's going to lock your hips down. Less movement in the hip means that neighboring segments have to take up the slack and move a little bit more. This is a muscle that affects the sagittal plane, but it also affects the rotational plane as well. And what you don't see on the image that I've shown you right here is we've got this hip joint that's exposed, but around that hip joint, we've got capsular fibers, connective tissues that secure that joint as well. And many people can get tightness in that capsule as well. And that will lead to reduced rotation of the hip. The story of Andrew Gorecki, my friend in Northwest Michigan, he couldn't internally rotate his hip. And when he took strides and that lack of rotation was evident, his back made more rotational motions. And remember what I said before? The back is only intended to rotate about 10 degrees in 5 degrees in each direction at the lower back. So he was experiencing increased mechanical stress at the lumbar spine, but the root cause of that pain at the lumbar spine was his inability to move well at the hips. And so a three-dimensional analysis of your ability to move in the sagittal plane with your hips, in the frontal plane with your hips, and the transverse rotational plane in your hips could give you evidence of a root cause of something that's causing mechanical stress to give you low back pain itself. Okay? That is the one of the close causes. Remember I said earlier, when we're in a bad mood, it affects the people closest to us the most. The body is no different. Let me give an analogy for a little bit. Let's say there are 3 people working on an assembly line in a manufacturing plant. And as the product comes by, they're doing some work together to accomplish this task before it goes on down the line to someone else. And if everyone's doing their part, the work is shared equally. But let's just say for a moment someone says, you know what, I don't really feel like working. The other two have to pick up the slack. Of those three people, who's going to experience more physical stress? Who's more likely to be injured or hurt or feeling pain, fatigue at the end of the week or month? If that one person doesn't do the job, the other two have to work harder. And we see evidence of this in the human body all the time. Most of the pain you experience is due to physical mechanical stress at that particular part. But the true cause, you have to look around. Western medicine teaches us to look inside the box. What hurts? If that hurts, I'm going to give you a medication. I'm going to do an ultrasound. I'm going to put electrical stimulation around there. I'm going to give you an injection in that spot. That thing will no longer hurt for you. Well, that's great. But we also need to be able to function. And if we continue to function where we haven't looked beyond the box, you're going to continue to put pressure on that tissue, and any benefit you got from that treatment inside the box is likely to fade. It's not going to be long lasting. You need a root cause solution. So at the mid to upper back, that's the closest neighbor just above the lumbar spine. The thoracic spine is made up of 12 segments above the 5 segments of your lumbar spine. And there's something unique about the thoracic spine. It has the ribs that connect to it. We literally have a cage in the middle of our trunk. And that cage means there's not as much motion that happens at the thoracic spine when compared to the lumbar spine below and the cervical spine above. But any ability that should have that it no longer has to get transferred to its closest neighbors. And so if we see people that have issues with both lower back pain and cervical neck pain, usually the thoracic spine is the thing we need to go to. That's the common denominator. It's not uncommon for someone to have lower back pain and knee pain. The common denominator of that is the hip. We're more likely to find a dysfunction of movement in some way, shape, or form at the hip for those people. But if you've been seen by someone trying to help you with your back pain and they've not helped you remedy movement issues or even looked at the movement capabilities of the hip and or the middle to upper back, they need to look at that as well. Just like your hip and just like every other body part, your thoracic spine needs to rotate well, needs to side bend well, and it needs to flex and extend well. It needs to move in all 3 dimensions well, or other areas around that area, in particular the lumbar spine, will take up the additional slack and will potentially be asked to do something it's not designed to do, which leads to mechanical stress and pain. Finally, a little farther away from the low back, but still an influencer of low back pain, is the quality of your foot. In this particular demonstration on the left side, we see someone that has a fallen arch. And so the heel is everting. The arch drops. The knee falls in. We call that valgus, but you're kind of knock-kneed. It changes the stress on the hip. The pelvis is off a little bit. The back has to make an adaptation to that. This can cause pain in a variety of spots, but it's not uncommon for a foot issue like this, if you're on your feet quite a bit, to contribute to your low back pain as well, to be the primary cause of that. So I'm going to say this one more time. If you've gotten conservative care from someone who's helping people with low back pain, you need to make sure that person has looked at your hip and can it move in all 3 dimensions? Has that person looked at your mid back and made sure that it could move in all 3 dimensions? And then have they looked at your foot to see how it functions well in all 3 dimensions? Lack of mobility or too much mobility in any one of those parts is going to put neighboring areas at risk, and your low back pain is often the recipient of that stress and therefore where you're going to experience that pain. So the bottom line is, if your hips don't move properly, if your mid to upper back doesn't move properly, if your feet don't move properly, your back can suffer as a result of that. And anytime a tissue is asked to operate outside of its normal design principles, it's subject to progressive damage, and it's likely that eventually a pain experience is going to occur. But remember, that could be a process that takes time. It's cumulative in nature. I wish I had a dime for every time someone said, I don't know why I'm hurting. I'm not doing anything different than normal. Well, I want to know what normal is to you. Because if normal means your hips don't move well in the rotational plane, or your thoracic spine is locked down, or you got this fallen arch, then we got to get to that root problem, or those root problems, to make your back happy again. Last but not least, successful treatment of lower back pain. And it's pretty simple at this point. To eliminate the pain, you got to go to the cause. You got to look at the root cause. Your physical therapist or back expert needs to understand root cause analysis in order to get rid of the cause of your pain. So here's what successful treatment looks like in our experience at Kinetic Physical Therapy. First of all, it has to be individualized. What worked for someone else isn't necessarily going to work for you, because their problem is unique and your problem is unique. Unless we understand your unique problem, we can't give you a unique solution to that problem as well. And so being handed exercise from someone that hasn't done an assessment and looked at the whole body from a global perspective, movement above and below the low back, even all the way down to the foot, and your benefit is likely to be temporary at best. Our approach at Kinetic Edge is we want to educate you and empower you. You need to know what to do at the right time to do it, so that you can repeat it. If you have an issue that's the result of something cumulative in nature, you need to have a cumulative strategy to overcome that which brought that on over time as well. And I think that's most effective when you're doing that in a one-on-one setting. If you're working with someone that's trying to treat 3 people simultaneously, they're not going to be attentive to the needs that you have that are unique to you. Sometimes that does require some hands-on type of treatment. But we're learning through the COVID epidemic that telehealth options and assessing movement 3-dimensionally is certainly possible using a video, and you don't even have to have hands-on for those things as well. But the key is, whether you're getting this assessment in a clinic setting or online, is that your solution needs to be focused on you and needs to be combined with movement and exercise to overcome the true cause of the problem. Unfortunately, there are 3 problems that make that less likely to occur for you. First of all, our memories aren't that good, and I'm saying that for me too. I've reviewed this material several times before talking to you again tonight, even though I've been doing this for 24 years. I've given you a fire hose of information, and you're not going to remember much of it. So you're going to need refreshers. The other problem is you don't know what your specific problem is, so you don't know what your specific solution is as well. And though it's pretty poetic to say knowledge is power, I respectfully disagree. Knowledge does no one any good unless that knowledge can be applied. Implementation is absolutely necessary. So you need to know what your problem is. You need to know what the solution is, but you need to be able to implement it in a practical way on a regular basis in order for you to get true relief that lasts for your lower back issue. So the solution is finding the root problem. What is it? Where is it? What do you need to do to make it get better? How often do you need to repeat that? That will take the stress off the painful tissue. So what we want to offer for you, for those of you that have committed time, if you're interested in learning for you the specific things you need to do at absolutely no cost to you, we want to give you a natural low back pain relief consultation. That can be done in a variety of formats that we'll talk about. But in doing that, you're going to learn specifically what type of back pain that you have. You may already know that at this point, having heard what you've heard tonight. That will allow us to label the type of back pain for you, but we want to go beyond that and give you a root cause analysis as well. I think it'll be pretty easy for us in just a short period of time with one of our experts to give you 2 or 3 things that are causing stress on your low back. And then finally, identifying what the mechanical fix is as well. And in doing so, deliver what we like to deliver the most at Kinetic Edge Physical Therapy. Our mission is transforming lives and restoring hope through movement. And so that free screen is a chance to get a little bit more information that's specific to you to determine whether a course of care or something like that's necessary for you. So the benefits are that you can do what's truly necessary to solve the root problem. You can stop wasting time and money on things that are only temporary at best. And you can enable your body to go through what it naturally is equipped to do, heal itself by getting pressure and stress off the tissue that's crying out for relief at this point. Hopefully that enables you to become your old self again too. So the things that we talked about before, that up and down cycle of pain that gets pretty old quickly, can be a thing of the past for you as well. So again, before we leave, just a quick recap. If it hurts more when you move, and there are specific things that bring it on, if your pain is reproducible, that's good, because then it's also reducible. And we got to find out how to reduce stress on that tissue by looking at the closest neighbors to the low back itself. And that means we got to look at your hips, we got to look at your mid to upper spine, probably should even look at your feet. There are only 3 ways to handle the problem, and I want you to stop ignoring it. I want you to stop altering it. Stop spending on money on things that don't really get to the root of the problem. I want you to handle the problem once and for all and fix it at its root cause. I also want to encourage you too, it's not your fault that you're in this situation. You've tried to get help in the past, most likely, although many of you are probably stubborn and ignored it for a while. But most of the experts that you go to don't know this stuff, and so they give you what they have had some limited success with, but the information that most need to have does not get to them because most don't know that. You got to get to the root problem to get to the true relief point. And that's why we want to offer you that free natural lower back pain relief consultation. Why? Well, we know that lots of people have this problem. Musculoskeletal issues are the number 2 reason to see the doctor. 80% of people have lower back pain at some point in time. And believe it or not, only about 10% of people that need our help get to us. So there's a huge number of people that could benefit from getting access to this. We also are committed to telling this story over and over and over again because the opioid crisis is real and scary. Surgeries are skyrocketing and they're not terribly effective. And ultimately people are spending money only to have their hopes crushed. We know there's a better way. So that free 20-minute consultation, something that typically would cost about $150. And I'm telling you that because I also want to give you a guarantee. If you choose to do that and say, you know what, that was a waste of my time, we have a guarantee that says if you say that, if you didn't get anything out of it, if you didn't learn anything that was beneficial for you, well, then we're happy to say, hey, you know what? What's your favorite charity? The $150 free item that we gave you, we're going to actually write a check and we're going to send that to that charity. So that's a great guarantee, and hopefully that's something that encourages you to give it a second thought as well. What you will actually get as a result of that is you'll get a consultation summary, a brief but very clear summary of what type of back pain you have, what's really causing it, and what are some things that need to be done to make that real problem go away. And that'll be yours to take with you after the consultation as well. So we are at the end. I want to tell you, if you want to sign up to reserve your spot, as soon as I close out this session here in just a little bit, you will get sent to you, or it might even show up on the screen as a link to a survey. And while it's fresh in your mind, I want you to answer the questions on that survey. I promise you it won't take you much time at all. It's just 2 or 3 or 4 simple questions. And then if you want to have a free screen with one of our providers, you can say, here's my name. I want to do this online, or I want to do this in a clinic, and here are the 7 clinics you can choose from to do that. So in just a little bit, you get that, and I want you to fill that out if you would, please. My name's Troy. I'm the one that's been talking to you for the last hour. That's my information right there, too. So if you want to, fill that or write that information down. That's my personal cell phone right there. You can text me, you can call me, you can send me emails. I encourage that. We don't want this to be the end of the conversation if you have personal questions as well. Thank you so much. Appreciate all of you that have given of your valuable time. My hope for you is that you receive hope through this as well, that you understand that there are solutions to your problem. And chances are you're in that population of people that simply just have not found the root cause of their problem. And that solution for you is not very far away. Thanks for your time. Please, again, consider filling out the very brief survey that's coming your way and sign up for the free screen. Take care.